Okay, so it looks like we've got a good turnout today. I want to say welcome to everybody and thank you for joining us to another Contagion Culture lecture here at the School of Policy Studies. My name is Warren Mabey and I am the director of the School of Policy Studies. I'm delighted to see so many people coming online. I want to begin our session just by acknowledging that we are meeting on the traditional territories of the Haudenosaunee and the Anishinaabe peoples. That's where I am. You may be in many different places and you may be on many different traditional territories. Please do take a moment to acknowledge that and to recognize that and reflect on that as we begin this session off. As I say, I'm delighted to see so many people out. We've been running Contagion Culture lectures throughout the summer, talking about COVID-19 and the various ramifications of this pandemic on many different aspects of our lives and our society and on governance. So we've talked about a number of different issues throughout the summer. I would encourage you to check our website. There are many of the talks up in video format, and I understand there's more being put up all the time. So you can go back and look at some of those talks that have been done. There's been some really interesting discussion, really interesting questions. I strongly encourage you to check those out. Before I introduce this week's speaker, let me put in a quick plug for the next couple of weeks. Next week, we have Elizabeth Hanson, who is a Queen's Prof here in the English department. And the week after that, we have two fellows from the School of Policy Studies, Don Drummond and Duncan Sinclair. And I strongly encourage you to tune in for those lectures. I think that we're continuing a series of excellence here, and I really appreciate all of the input from our different speakers throughout this term. Our speaker today is one of our distinguished fellows, Helen Cooper. Helen is a Queen's grad, so she knows this institution very well. She was the mayor of Kingston. She's been the chair of the Ontario Municipal Board. She has served a variety of different roles throughout her career. We are very lucky in the School of Policy Studies to have Helen as an advisor and as a guide to help us with all of the things that we're working on. I'm personally really happy that she's been able to make time in her schedule to join us and to give us a presentation today. And she's going to be talking about local government responses to the COVID-19 pandemic. So Helen, I'm just going to share the screen to get your slides up and running here. And then I'm going to hand right over to you.
Okay, thank you very much, Warren. I'm here to talk about what I've called the Kingston case. Also, I'd like to recognize Samantha Kiefer, who is a recent graduate of the MPA program who helped me considerably with this. And Samantha is now working for the federal government in Ottawa, and I understand she's doing her best to tune in today as well. Now, I'm not starting from the very beginning. I'm looking at the fact that on August the 27th, the Ontario government had gained sufficient knowledge about the pandemic that they had produced what they called a framework for reopening, a total of 4 phases. We're now, in most places in the province, at least in phase 3. Well, on May 5th, the medical officer of health for this region, which is Kingston, Frontenac, Lennox, and Addington, as well as the mayor and the wardens, wrote the province, the premier, and said, we've already met it, the criteria for phase 1, could we please start opening? And the premier said no. This was all too new for everybody. And he was worried that because Kingston area was so low in terms of incidence, that it would attract people from a variety of other places who were much more confined than as Kingston turned out to be. So by June, mid-June, only 23 cases, virtually no need for hospitalization. In fact, that's been an issue for the hospital sector, that they closed down a number of other services when they did not need to. However, then on June 25th came an outbreak in a local nail salon. But I will go into more detail about issues like testing and contact tracing to show that the public health, Kingston, Frontenac, Lennox, and Addington Public Health, I'll just call public health, had shut it down really fast, and it wasn't just good luck, it was very good management. So the reasons for public health relative success: very early action by local epidemiology and infectious control experts, well-established relationships amongst the healthcare sector, flexibility of public health employees, and the responsiveness of the local business community. Now, before we can go into what happened, I just, a brief lesson in applicable legislation. The province has the Emergency Management and Civil Protection Act. Along with it came a much more recent piece of legislation called Reopening Ontario. We have to talk about the Long-Term Care Homes Act because municipalities are one of the service providers for long-term care, and the most critical act of all for public health is the Health Protection and Promotion Act. So the first that I talked about, I list for you on the slide the bare bones of that legislation. I was a mayor in the 90s, and the idea of emergency response was in its infancy. And that's one thing in doing this research that I've learned. Things have progressed appreciably, and the legislation is much tighter, much more expansive. And it's the role of municipalities in responding as they must is much more refined than it used to be. So I hope that's encouraging for people to hear. So what's interesting, however, is that on July the 21st, majority government in the province of Ontario passed the Reopening Ontario Act, and in essence took away authority from the legislature for determining the declaration of an emergency. The only person really significantly to protest was a member of the Conservative caucus who was then invited to not join caucus. But it's a fairly serious act on the part of the province. But of course, we're also consumed with COVID that events like this can occur, and they don't get the proper attention that they might have otherwise. So the Long-Term Care Act, which is the other one I talked about, we have, there's the information, 626 long-term care homes. The private ownership is by far the most significant, but municipalities do have a stake in this as well. Now, the province had currently slated over 300 homes to be redeveloped because of inadequate safety and accommodation standards. We know that the initial COVID outbreaks occurred in homes where people are sharing, 4 people sharing a room. They still exist, and that led to transmission problems we surmise are much more seriously than would otherwise have been the case. And these are the homes that are slated for improvement. The critically important factor in this legislation is the need for inspection, regulation, inspection, and accommodation. Appreciating that the province of Ontario itself does not actually own or operate any homes, but it does provide the standard service and the inspection service for homes. So they can be according to complaint, but there's supposed to be what's called a resident quality inspection annually for every home in the province. So what happened in 2015, 16, 17, the comprehensive inspections were conducted. In 2018, just over half the inspections were conducted. In 2019, 9 long-term care homes received an overall inspection. And then as of May in Ontario, we know it's been widely publicized and reported on that the death rate in Ontario due to COVID-19 was very high at the beginning of the pandemic, and it was primarily people living in long-term care. And you can see that the for-profit homes, the death rates were much higher than they were for the municipal home. It's 3 times higher, roughly, 2.5 times higher. And I put in some other statistics there emphasizing how critically important this was in the early stage of the pandemic. So the government has responded by launching an independent commission to identify ways to prevent future spread of the disease and presumably any other potential pandemic in long-term care. The Health Protection Promotion Act is what gives public health units the powers they have to regulate human behavior, to impose fines, a whole plethora of powers. And we know public health units. They do non-smoking or smoking cessation programs. We hear from them on a variety of public health issues, but the critical factor in this, our current COVID days, is their epidemiological role and the role of a medical officer of health, which is quite powerful. There are 35 boards of health in Ontario, and what's happened is that over the years, since the 1960s, there have been progressive changes in the structure of municipal government. We know Toronto became a big city, as did Ottawa, as did Hamilton. Amalgamations of various smaller municipalities into a larger whole. We also see the development of regional municipalities for those areas, particularly in the GTA, where populations increased dramatically and county governments no longer sufficed. And what we have left are regional health units like the one in Kingston, which are combinations of separated cities and their surrounding counties, just where the populations are not as significant. How is public health funded? It's jointly funded between the province and the municipalities, but there's no set formula. So in 2017, the previous government, Ontario government, recognized the need for change in structure of public health units. As I tried to point out in the earlier slide, changes in municipal boundaries and municipal structures have happened considerably over several decades now, but the public health role hasn't moved with it. And so this fairly comprehensive study on the part of the province of the day wanted to strengthen the role of public health in recognizing a greater focus on social determinants of health, greater population variables as to who's healthy and who isn't. And I think COVID has been very dramatic in illustrating that certain people have been far more disadvantaged in contracting this disease than others. And there are underlying population factors. And so they recognized, I don't know that they recognized, there had been other serious diseases entering into our population. SARS is the best example of recent memory, that they were recognizing that public health had to become much more sophisticated in terms of development of epidemiological understanding. And so consolidations became inevitable because there are many public health units who simply don't have the population or the resources to be able to respond. So what the current government had proposed in April of 2019, just 6 months or so before our pandemic arrived, is they wanted to reduce public health units from 35 to 10. They wanted to take $200 million out of the public health system, arguing that amalgamations would lead to administrative efficiencies. And municipalities fought back immediately, saying this just couldn't possibly happen without municipalities having to give a greater share. And I thought this was interesting as a footnote. In July, just last 2 months ago, the Financial Accountability Office reported that public health had been underspent by $49 million in the last fiscal year. So looking focusing in on Kingston and Frontenac County and County of Lennox and Addington, it's a population just under 200,000. There are 11 long-term care homes. The ratios are very similar to the ratios for the province as a whole as to ownership. And the healthcare resources. This is where we really stand out for a population our size. We have the Health Sciences Complex. We have Province Care Hospital. We have Queen's University Faculty of Health Sciences, and we have the Public Health Unit. So we are well endowed. And what I discovered from various readings I did is there's this vast array of interconnections among the health institutions in this city. I've just listed a few of them here. Fred appoints a staff person is appointed to the Public Health Unit to work on epidemiological issues. I can't get my head around the names, Queen's Health Services and Policy Research Institute, and then the Medical Officer of Health. We are extremely well endowed with a very knowledgeable Medical Officer of Health, whom people have a great deal of confidence in. But you can see that he's also connected strongly to both the other healthcare institutions and with Queen's University. So here's the story. There's much more detail to it. It's very interesting. The chair of the Division of Infectious Disease identified the potential for a pandemic in December 2019. And that's when he read about what was happening in Wuhan. And then he worked in consultation with the Medical Officer of Health, and they began to activate their incident management system in January. And in February, they introduced heightened infection controls into the various medical establishments, care establishments, clinics in the city. And this was at a time, I think this is really important, this is at a time when the Canadian government had stated that Canada would be largely unaffected. In other words, people here were proceeding on the basis that there could be an infection here. I would say they were well ahead of the pack. So it wasn't until March that Ontario struck its command table. And what happened locally in March, throughout the month of March, I've listed it there. Public health nurses sent out into the community. I think this is particularly interesting, that teams of public health nurses and health inspectors visited every long-term care home in the region. And in other words, the health unit redeployed health inspectors because by the time the command table had been struck, we were into lockdown as a province. And so health inspectors couldn't be inspecting restaurants because they were closed. So they said to health inspectors, now you will go out with public health nurses and talk to those places where the most vulnerable people in our community are living. And then they established an agreement with the municipalities around redeployment of healthcare staff. The Medical Officer of Health was a strong advocate for early testing and contact tracing. And when initial tests that were being performed in the US, the testing system was flawed, he was able to work with the molecular biology lab in the Health Sciences Center here to create our own functional test. And then 26 staff at public health were trained and began contact tracing. And it does need training for people to know when they contact people what to ask them. So on March 17th, the Ontario government declared its state of emergency. The mayor on 26 declared the state of emergency in Kingston. And by May 27th, because I've already listed for you all the things that the city and the public health unit and the health sciences centers undertook, Kingston had this very enviable record, and the medical officer of health reported that he had heard from health units all over the province for advice as to what they should be doing. Okay. So I'll just talk very briefly about, we could have rested on our laurels as a community, but there was an outbreak later in June. But again, because the testing and contact tracing system has been so well established, the public health unit was able to snuff out the outbreak extremely quickly. And that induced them to order mask wearing in public indoor spaces. And I've listed for you the case rate as it's progressed since then. It's still one of the lowest case rates in the province, and the hospital system has been virtually unaffected. Okay, so what has the city done in all of this? I've looked at service delivery, financial implications, and economic recovery. Now, the city did what I'm sure every city did, and close anything where people were likely to normally congregate. My list is there. It's not exhaustive. I do wish to point out really clearly, though, is that most municipal services we take totally for granted. And municipal workers were working all over the place throughout all of this, because we still expected our garbage to be picked up. We still expected clean water coming out of the tap. If I may be so crude, we expect effluent to disappear when we flush our toilets. And we expect the lights to come on. We expect a whole host of activities to continue to occur. I put in marriage licenses. I thought that's important. People still want to get married. And, but also the city is responsible for a huge range of social services, including housing management. And going back to what I said a few minutes ago, we know that people who were low income were more disadvantaged throughout COVID than people of higher income. So the city had a very important role in keeping people safe through their social service provision. And so we have what's called a consolidated municipal services manager run by the city, social services provision for both the city and Frontenac County. And the city administered emergency financial assistance, provided access to licensed childcare for emergency workers, essential workers. And what is a particularly pressing problem, not only in this city, but everywhere, is the needs of homeless people. Of course, they're the most vulnerable of all. They have nowhere to go, and if they're likely to endanger themselves and others when they can't move to their own little bubble. So what happened is an encampment set up in a tent city in a park in the north end of the city. The city didn't attempt to evict them immediately, quite the contrary, gave them access to temporary sanitary facilities, but eventually said, you've got to move. Before doing that, however, they created what they called an integrated care hub in a recreational facility in downtown Kingston and invited in social service agencies that were other than city agencies to set up a comprehensive service system within the hub. It still didn't satisfy some of the campers. There's been a great deal of controversy, both within City Council and within the larger community, as to whether the city ultimately evicting the campers was the right thing to do or not. What's important to know when looking at financial aspects of the city is that all municipalities in Ontario by law cannot incur year-to-year operating deficits. If you run a deficit in one fiscal year, by the way, a municipal fiscal year is the calendar year. If you run a deficit in one calendar year, you have to make it up in the next one. And the city has projected its user fee revenue loss just from May to August. That's the most recent report that I've been able to see, is 13.4 million, which is not peanuts. Just like everywhere else, public transit is the main component. Excuse me, I'm sorry. We know in Toronto and Ottawa in particular, the fact that people started working from home, people were reticent to use public transit, that the revenue stream there is seriously affected the city's function. The city has done a number of things to try to relieve costs, particularly in the early days when we had complete lockdown and a lot of businesses that invite the public, of course, couldn't open their doors at all. And so the city recognized their need to save money or not spend money they didn't have in the ways that I've listed here. The city's estimated and that was their August estimate, that the deficit this year will be 4 million. And that's through also reviewing their strategic priorities and simply postponing certain things or giving them up altogether. And they're also looking, Kingston's very dependent on the hospitality industry, has been doing reasonably well. It looks as if it's been doing reasonably well over the summer because of people being able to be outdoors and eat and drink outdoors. But once the colder weather, as it has come now, there may be a serious reduction in revenue, and they're offering additional tax relief in that regard. They cannot know what the deficit really is until well into 2021. And there's just a headline in the local paper today about a significant business on Princess Street that is leaving for good. Significant in terms of square footage. So who knows what's yet to come in that regard. Now, the feds announced money to the provinces. The province of Ontario said it would transfer some of this to municipalities, but I'm saying that's a one-term hit. Who knows what will happen in 2021 and beyond. What else has the city done? The city we'll go on to economic recovery now. The city has, through its Economic Development Commission, has partnered with the Queen's School of Business. Again, this is another time when we say how well endowed we are as a city by having such a large and diverse and established university in our midst. The mayor started the Kingston Economic Recovery Team, and they've made a number of recommendations. It's a team that includes business people, but it also includes, for instance, the executive director of the United Way and others with a broad community interest. So I had pointed out at the bottom of that slide, right, that I've already said tourism and is a critical factor. Queens is another critical economic factor. And there's no doubt the businesses have suffered, the hotels, the restaurants, because of graduation and homecoming no longer happening. And I guess in 2021, you know, I'm thinking if graduations are still not in person, that will really hit a number of businesses. So I'm winding down now. I had a total of 4 recommendations coming out of the work I had done in looking at this, and I see it's 4:30, so that's just about right timing. I point out the response to the pandemic, I hope I've illustrated that, has been remarkable. People in positions of authority have shown initiative and have responded rapidly. I think this should be recorded for a much broader audience. And I think too that, and I'm sure it will happen, that the public health unit, the health sciences unit, the city will have some kind of postmortem on this to be able to say, what did we do well, what could we have done better? But it should be documented because the response here has been truly remarkable. And I think it was borne out by the fact that it was looked upon as a model by other health units in the province. So I hope coming out of this that there will be a well-documented, step-by-step proposal for what to do in the course of hearing bad news from other parts of the world. I think also what I found in trying to get information is that public health units across the province are they're doing their own thing in terms of reporting. And it's really difficult then to do comparative analysis. So I would suggest coming out of this that Ontario Public Health should be leading development of a much more consistent reporting system, not only for COVID-19, but for a number of other public health issues. To the Ontario government, the restructuring of public health, I think that this pandemic has shown the vital alliances that need to occur amongst the healthcare system, amongst public health and the municipalities. So you would not want to mess with borders or boundaries that would upset this. What's the old adage? Form follows function. Looking at what's happened with this pandemic and the functions that are performed for various parties, that any restructuring should be aligned with those functions. Just by saying that health units would have gone from 36 to 10, I think I had part 35 to 10, that wouldn't have happened if that occurred. So I think the whole public health restructuring exercise, it must occur, as has been pointed out, to get adequate epidemiological sophisticated resources to each public health unit, but it also needs to be, it needs to include consideration of other key players in responding to any kind of epidemic or pandemic. And then the level of resources required for each public health unit, it needs people who understand infectious spread and epidemiology and how it affects different populations within their boundaries. And so I trust the provincial government has also learned something out of this, that a restructuring exercise has to be very sophisticatedly handled. Also, how it's funded. And then lastly, or no, I've got 2 more to go. I've got 3 and 4. I'm saying, just very quickly, municipal homes for the aged or long-term care homes manage seemingly better than either the private sector or the not-for-profit sector. And I hope the independent commission will look very carefully at why that is the case. I shouldn't speculate at this point. I will say, however, that the homes in Kingston are unionized. That probably means there's better wages and less staff turnover than might have been the case in other places. Okay, and my last one is tax policy. Municipalities are providing a huge variety of services that have got nothing to do with property tax or user fees. And it's happening, it has happened more and more. And municipalities, particularly in the arena of social services, which I don't know how anybody can justify that a property tax system should be supporting social housing, because that's really an income support. So what I am therefore saying is that property taxes and user fees can often be regressive taxes. They can impinge on the quality of life of poorer people more than affluent people. And I'm therefore suggesting that a one-time gift to municipalities to get them past 2020 is certainly not going to be turned down, but it isn't a solution to taxation issues for municipal governments. So people have talked about COVID being the opening for looking at a variety of social changes, basic income being one, and I would suggest looking at municipal taxation policy would be another, but I'm not very hopeful. So that's it. Thanks very much.
So Helen, thanks so much. That was a really wonderful and thorough review of kind of what's happened and the response here in Kingston. I really must echo what you said. You know, we've been so lucky in Kingston to have had a tremendous team that has managed this, and you know, we've seen such a positive response over the last few months compared to other parts of the world. I think we're very, very lucky. We do have one question that was posted in the chat, and I would just quickly point out that we have both the chat and the Q&A function that are available to you to post questions. So I'm going to go to Duncan's question first. Duncan Sinclair is writing, what form of progressive tax structure would you advocate for municipalities? Quick question.
Yeah, well, years ago, we used to have something, municipalities used to have something called unconditional grants. They were eliminated in the early 90s. What they really were an income tax transfer to municipalities. It was, here's some money from the province for you to do with as you see fit. I think, because I'm not advocating that municipalities send out their own profit or their own income tax bills. Far be it that I would ever suggest that. But a share of income derived from other than property tax and user fees, which are the two mainstays of municipalities, I think is totally warranted. And it would take tax experts quite a bit of work to look at what functions municipalities are providing that are in no way related to service to property, and then apportion an unconditional transfer. I think that's a fair thing to say than grant. An unconditional transfer that would cover at least a portion of those costs.
Okay, thank you. We've got a question from Florence Campbell within the chat. Public health receives less than 5% of the provincial health budget, and 95% goes to curing illness. Do you think the pandemic will result in a more equitable ratio between preventing illness and promoting health and curing illness. So I think that I've got that right. Do you have any comments on that?
Well, yes. I mean, the pandemic has illustrated, and I highly recommend that people 2 weeks from now get to Don Dermott and Duncan Sinclair's presentation on long-term care, because they've done something absolutely brilliant. And we look at the budget for healthcare. The other proponent or component, which is one could argue is well underfunded, is home care. So we've got the preventative functions that need more support. I think I'd say to Florence, if when you see Duncan and Dawn's presentation, that gives options, and included with that should be more attention to public health. I mean, we've had a terrible scare here, and we've now come to understand how important it is. And I think those areas of the province that are still seeing spikes, and areas where long-term care was such a serious problem, will be saying ever more, we need a much more sophisticated public health function. When I listen to medical experts, they're saying, even though COVID may fade or may not, that doesn't mean there won't be others like it coming along. So we've got to be ready for this for many, many years to come.
Thanks. Bob Wolf has posted a question. Slide 7 was shocking. Now this is your slide about long-term care in Ontario and the arrival of COVID-19. And in particularly, he picks up on the residential quality inspections, the RQIs.
Yeah.
And the fact that it declined so significantly from 2015 and 16 and 17 to 2019. He's asking, why did the number of RQIs decline, and is there any link with the death rates in the long-term care facilities?
Yeah, Bob, I can't answer that question. I don't know why. We have this independent commission now. We know that when the Army went into several care homes, they reported some fairly serious problems about living conditions. So it isn't difficult to speculate here. But again, I would defer to Dawn and Duncan, who they've been looking at long-term care in detail.
And we'll hear a bit about that, I think. Another question from Mika. As the Consolidated Municipal Services Manager for the City of Kingston and Frontenac County, in what form did the financial assistance come in for those without income?
Well, it was, the province did advance funds to the municipalities. It just, what I was pointing out there is that the municipality became the administrator for this. So I can't give further detail on that, but it's not, this isn't surprising, because social assistance in general is provincially funded, but it's municipally administered. So that's yet another example of a municipal cost that's in no way related to service to property.
Okay. Question from our chat from Jay. If the provincial government went ahead with the restructuring of the PHUs, the public health units in Ontario, do you think that the current pandemic would have been handled better or worse, or about the same as our current status regionally or provincially?
Oh, well, that's again, it wouldn't have been worse. I don't think. In the larger paper I wrote for this, I quote Dr. Cushman, who is the former medical officer of health in Ottawa. highly respected and revered, and he is recorded as stating that some public health units, some of the smaller ones around the province, are really struggling. So I think they're just not the resources to do the kinds of things that our medical officer of health was able to do. So I think the answer to that question is, yeah, it would have been better.
But it seems to me, and just to follow up on that, that there might be a right size for the public health units, right? You don't want them to be too small and under-resourced, but at the same time, you don't want them to be so big or covering so many people that they're spread too thin, or that they need to be overly structured to be able to handle it. So
I agree. Yeah, and I think the point I was trying to make is they interact so much with their municipalities that, again, I was trying to envision what 10 public health units would look like, and you could very well have the case that municipalities could end up getting direction from more than one public health unit, or it just doesn't seem to jive with municipal boundaries as we currently know them, that's I don't think that would work very well.
We see similar sorts of things on the energy side of the equation, where we have local distribution companies that can be too small or can be too big, but it does seem to be a Goldilocks size out there that's just kind of right and allows groups to work together really well. I'm looking at my chat and at my Q&A. I don't see any open questions right now, and I do note that we are right at 10 to 5, and this is when we look to start wrapping these talks up. We want to respect people's time. I know that everybody has very busy days, and I also know that Zoom sessions can be much more tiring than you would think. It takes a lot to tune in and to watch these Zooms and to really take part. We have one last question. I think we'll take this last question and then we'll wrap our session. This is from Mike. KFLA was deemed to be rogue for requesting a regional approach. Can you comment a little bit more on that?
Yeah.
You did mention it a little bit.
Yeah, I think we have to be a bit forgiving of the Premier here. It was very early days of the pandemic, and he and many others, of course, had no idea how far and wide and this would spread. It was an unfortunate choice of words. As I tried to point out, Kingston area wasn't trying to break any rules or bend any rules. That the government had issued its document saying what the various phases would be for reopening, and Kingston had met the criteria. It's just they met it really early, and met them really early, and but it was clear the province wasn't ready for this at all, and was the Premier did say, you know, if we're not that far from, especially the east side of Toronto, and we're not that far from Ottawa, that if Kingston got to be known as the only place where you could get a restaurant meal or something like that, we might end up with visitors that we might not want. So, but the city did not go rogue.
No, we did not. We tried, but we didn't get there.
Yeah.
Helen, I think that this is a terrific place to wrap up our talk. I do want to thank you very much for taking time, and thanks to Samantha as well for pulling together this amazing piece of work. I think everybody on the line has enjoyed this talk and benefited from the discussion. And for those of you online, I'd remind you that we do meet on a weekly basis, so we'll be back again next week at 4 p.m. on Tuesday, and we'll have Elizabeth Hanson with us. from the English department. So please do tune in for that. And with that, I think that we can wrap everything up. Thanks to everybody who tuned in, and thanks so much, Helen, for taking time.
Oh, it's my pleasure. Thank you.